Hello everyone, for this lecture we're going to be covering the lower limb, which is part of the appendicular musculature. The lower limb muscles, they can be divided into 4 groups. The first group is going to be made up of the muscles that move the thigh at the hip joint. The second group will be the muscles that move the leg at the knee joint. Group 3 are muscles that move the foot at the ankle joint, and group 4 are muscles that move the digits. So let's get started on the next slide with group 1. Like I said, this group 1 will be made up of muscles that move the thigh at the hip. Therefore, to be able to move the thigh, they need to cross the hip joint. If they're crossing the hip joint, it means that they will have to originate on the pelvic bones or the pelvic girdle, and they need to insert on the femur. So there are several muscles that will move the thigh, because we know that the hip joint is a ball and socket type of joint, and it does several different types of movements, right? So it does flexion and extension. It does abduction, adduction. It does medial and lateral rotation. So there has to be lots of muscles in this region to be able to perform all these functions. Let's start with the muscles that are present in the gluteal region. We have several muscles that are located here, but we do have muscles that belong to the gluteus group. There are 3 muscles. The first one would be the gluteus maximus, which is this huge muscle over here that will cover all of your butt region. That's your gluteus maximus. Underneath, you're going to have the gluteus medius, and we can see it right over here as well. And underneath the gluteus medius is the gluteus minimus, which, like the name says, is going to be smaller than the other 2 muscles. In terms of function, all these muscles, as you can see from the arrows, they will do abduction at the hip. So they will move the thigh away from the body. Now, because the fibers are located a little bit differently, then the gluteus maximus will also do extension and lateral rotation at the hip. But the gluteus medius and the gluteus minimus, notice how the fibers sort of run in the same direction. So they will do medial rotation at the hip, both of them, the medius and the minimus. While the gluteus maximus, like I said, will do lateral rotation, and in addition, it does extension at the hip. In addition to the 3 gluteal muscles that we talked about, there's another muscle that's part of the gluteal group, which is the tensor fasciae latae. And the tensor fasciae latae is a small muscle, and it will continue as this iliotibial tract or iliotibial band going down. And the tensor fasciae latae, it will do a lot of the things that the gluteus medius and the gluteus minimus does. So it will do abduction and medial rotation at the hip. And as it continues as the iliotibial tract laterally, it will insert on the tibia, and therefore it will support the knee laterally and also help a little bit with extension of the knee. Underneath the gluteus maximus, we're going to have a group of 4 muscles that are smaller, but will do the same function as the gluteus maximus, which are lateral rotation and abduction at the hip. And these are the piriformis, the superior gemellus, and the inferior gemellus that we can see over here. In between the superior gemellus and the inferior gemellus, there's another muscle that's the same size as these 2, that's called the obturator internus. And the obturator internus will also have the same function, because the fibers are all running in the same direction and all the muscles are located in the same compartment. So all these muscles will do lateral rotation and abduction at the hip, as you can see by the arrows. So the piriformis, the superior gemellus, the obturator internus, and the inferior gemellus. The way that I remember that the obturator internus is between the superior gemellus and the inferior gemellus is by saying that Mr. superior gemellus and Mrs. inferior gemellus are having internal issues, and therefore the obturator internus is between Mr. and Mrs. gemellus. And because all these muscles that we talked about are in the gluteal region, this is a posterior view. When we come to an anterior view, we can see a couple of muscles, which are the psoas major, which we already talked about, and the iliacus, and both of them will come together to form the iliopsoas group, which we already talked about. And once they pass the inguinal ligament, remember, they will become the iliopsoas, and therefore they will also serve to flex the thigh at the hip, because they will pull your thigh in this direction up. Therefore, they will be flexing at the hip, decreasing the angle at the hip. Then we move on to what we call the adductors. These will also move the thigh at the hip, and they will do adduction, meaning that they will bring the thigh closer to the midline. And because they are moving the thigh at the hip, they will definitely originate on the pelvic bones, and they will insert on the femur. The adductors that I need you to know are the adductor longus, the adductor magnus, and the gracilis. So these are all adductors. So once they contract, they will bring it closer to the midline. Now the adductor magnus, like the name says, it's going to be this really big muscle over here, and it forms a little opening which is called the adductor hiatus. And through the adductor hiatus, we're going to have important arteries and veins that will pass through. And once we get to cardiovascular system, then I will bring this up again. But you're going to have the femoral artery and a femoral vein that will pass through this opening that's left over by the adductor magnus muscle. And once these arteries pass through this opening, they will become the popliteal artery and vein. And here we have the muscles highlighted. So this will be your adductus longus. Notice how it's going to be medial. Then you're going to have the gracilis, which is more medial than the adductor longus, and a little bit more posterior, but also medial, you're going to have the adductor magnus. But to be able to bring the thigh closer to the midline, they all have to be located medially. Let's take a look at the lab models and see which muscles we covered so far. Here we have the gluteus maximus. Underneath the gluteus maximus, so if we remove this, we can see the gluteus medius right over here. This is your piriformis. The one on top is the superior gemellus. The one in the middle is the obturator internus. And the one down here is the inferior gemellus. Then this would be your tensor fasciae latae that is continuous with your iliotibial tract. Moving on to the adductors, we can see the one that's more medial right in the middle is going to be the gracilis, and it goes all the way down. This one in front of it is going to be the adductor longus, and this one more posterior is going to be the adductor magnus. Again, gracilis, adductor longus, and adductor magnus back here. These are animations of the adductors of the thigh, and I will show them in the next slide. So notice how when the muscles are highlighted, that's when it's bringing the thigh in closer to the midline. So they are adducting the thigh at the hip. And here we have an adductor, which is the iliotibial tract, and we will see the animation on the next slide. Notice how when the iliotibial tract is highlighted, that's when it's moving the thigh away from the midline. With regards to the compartments of the thigh, the same thing applies as we saw on the upper limbs. Therefore, when we're talking about the muscles that are located on the interior compartment, they will serve as flexors of the thigh, and they will also serve as extenders of the knee, which we will see in the next few slides. With regards to the posterior compartment, they will mainly serve to extend the thigh, like we saw, for example, the gluteus maximus, and the ones that are located medially, they will serve as adductors, which we have already seen. Now, the posterior compartment of the thigh will also be important to flex the leg, and we will see this in the next few slides. So remember that muscles that belong to the same compartment will probably do the same action. Now we're moving on to group 2, and group 2 represents the muscles that move the leg at the knee. Now it can be a little bit confusing because notice how, with regards to the origin, some muscles will originate on the pelvic bones and some muscles will originate on the femur, and then they will insert on the tibia and the fibula. So what is this telling us? It's telling us that if the muscle is going to originate on the femur and insert on the tibia or fibula, that it's only crossing the knee joint. Therefore, it will do an action only at the knee. However, if a muscle is going to be originating on the pelvic bones and inserting on the tibia and the fibula, it means that it's crossing two joints. Therefore, it will do two things, one at the hip joint and one at the knee joint. So let's pay attention to this because sometimes it can be a little bit confusing. Let's talk first about our quads, which are our quadriceps femoris. Quadriceps means that we have four muscles that are going to be located on the femur, on the thigh. The four muscles are the rectus femoris, the vastus intermedius, the vastus lateralis, and the vastus medialis. Like the name says, vastus means big, rectus means straight. So we have three that are vastus, they're big, and one that's straight, but is also big. The only one that will cross both joints, the hip and the knee joint, is going to be the rectus femoris. Therefore, when the rectus femoris by itself, when it contracts, it will flex the thigh because it will be pulling, notice over here, it will be pulling your thigh up at the hip, so it will be decreasing the angle at the hip. So flexion of the thigh at the hip. Now all four muscles, the rectus femoris, the vastus intermedius, vastus lateralis, and vastus medialis, they will come together over here at the knee, and they will cross the knee joint. In fact, all four muscles will come together to form the tendon of the quadriceps femoris that will encase the patella in the middle, right over there, and it will continue as the patellar ligament to insert right over there on the tibial tuberosity. And by doing that, once it contracts in this direction, it will extend the knee. So it will make your knee become straight or back to an anatomical position. So again, if we're talking about the quadriceps femoris or the quads, they will all extend at the knee. However, the rectus femoris by itself, it will also flex the thigh at the hip because it's the only one that crosses the hip joint as well. There is another muscle that goes from side to side, which is called the sartorius, right over here, and this is your sartorius. And because it goes from the medial side to the lateral side, it will flex, abduct, and laterally rotate the thigh. And therefore, when you do this position right over here, or when you cross your leg, those are actions of your sartorius. This image over here is just to show you how the patella is going to be encased in this quadriceps tendon that will then become the patellar tendon as it moves on and inserts on the tibial tuberosity, which is this projection right over here on the tibia. These images will show in more details the muscles that we were talking about. This would be your rectus femoris right over here in the middle. On the medial side, you're going to have the vastus medialis. On the lateral side, the vastus lateralis. Underneath the rectus femoris, that's where we see the vastus intermedius. So if we cut over here and remove part of the rectus femoris, you're going to be able to see the vastus intermedius underneath. Also notice how the sartorius goes from the medial side to the lateral side. So when it contracts, it's able to do flexion, abduction, and laterally rotate the thigh. And again, if we're talking about the quadriceps femoris, they will all extend the leg. However, the rectus femoris will also flex at the thigh. Now on the next slide, we will show this animation. Now notice how when the muscles are highlighted, that's when the knee is being extended. In the models in the lab, this will be your rectus femoris, an anterior view and a big muscle on the femur, rectus femoris. This one over here is your vastus lateralis. Therefore, this one is your vastus medialis. And this image over here, we have removed the rectus femoris, but we can't really see the muscle, the vastus intermedius, so we don't have it on the list. But just remember that the vastus intermedius is located underneath the rectus femoris. On a lateral view, we can see the vastus lateralis over here, and on a medial view, we can see the vastus medialis right over here. Again, we have the adductor longus, the gracilis, and the adductor magnus back here. You can also see the adductor magnus over here because it's a big muscle and it comes to the front. And right over here is the adductor hiatus. Remember we talked about? So these blood vessels over here are the femoral artery and vein. And once they pass the adductor hiatus, they become the popliteal artery and vein. Another muscle that we can see is the sartorius, how it goes from side to side. There are a couple of muscles that I would get confused, which are the gracilis and the sartorius. And the way that I remember is that sartorius starts with an S, so it goes from side to side. And the gracilis starts with a G, so it's located in the groin area, right in the medial part of the groin. Now another muscle that we can see over here in this image, when we remove the sartorius, we can see a little bit of the sartorius over here. So this muscle right over here is what we call the iliopsoas. Remember that the psoas major and the iliacus come together, and after they pass the inguinal ligament, which is right over here, it will become the iliopsoas. So this is your iliopsoas, and when it contracts, it will cause flexion of the thigh at the hip. Still with regards to group 2, now we're looking at the posterior compartment of the thigh. These muscles, they will originate on the pelvic bone and they will insert on the tibia or the fibula, and therefore they will be crossing two joints, which are the hip and the knee. At the hip, they will extend the thigh at the hip, and at the knee, they will flex the leg because they're moving in this direction. So they're going to be increasing the angle at the hip, and they're going to be decreasing the angle at the thigh. And what are these muscles that are known as the hamstrings? We have two on each side. Well, really, we have two on one side and one that has two heads on the other side. So on the medial side, we're going to have the semimembranosus that's deeper and the semitendinosus that's on top of the semimembranosus. And on the lateral side, we're going to have the biceps femoris. Like the name says, biceps, it means that it will have two heads. So the long head is on top and the short head is on the bottom. And these four muscles, they will form what we call the hamstrings. So again, in a little bit more detail, the one that's highlighted over here is the semitendinosus. Underneath is the semimembranosus on the medial side. And on the lateral side, more superficial, is the long head of the biceps femoris, and underneath it will be the short head of the biceps femoris. So let's look on the next slide, the animation of how the hamstrings will work to flex the leg at the knee. So here you can see when the muscles are highlighted, that's when you're flexing the leg at the knee. For the leg models, the hamstrings are definitely going to be located posterior as well. One thing that I should mention is that for our lab models, we're always going to have a left side and never a right side. So even for the upper limb, it's always a left side. For the lower limb is always a left side. for the hands, for the feet, the bones that we were talking about, those are left sides. Therefore, this is important for you to be able to orient yourself when you're looking, for example, for the biceps femoris. So if this is a left lower limb, and we know that the biceps femoris is lateral, then this would be your biceps femoris. Therefore, on the medial side, this will be your semitendinosus. And underneath, we can see a little bit of the semimembranosus right over here. But on our medial side, we can see a little bit better. So the outer one, see how there's a line over here? So the outer would be the semitendinosus, and this would be your semimembranosus. The way that I remember that the semimembranosus is on the bottom, because this looks like the interosseous membrane. Remember, we had the interosseous membrane that connected, for example, the radius and the ulna, and it was like a little membrane. So that's how I remember that the one that's in the middle, squished over here, is the semimembranosus. If we remove this muscle, which is the long head of the biceps femoris, underneath we can see the short head right over here. So this is also part of the biceps femoris. Next, we're moving on to group 3, but because some of the muscles will originate on the femur, then I place group 2 and group 3 together. So if they're part of group 2, they move the leg at the knee. If they're part of group 3, they move the foot at the ankle. And because some of them will cross two joints, right? Because they originate on the femur and insert on the tarsal, they're crossing the knee joint and the ankle joint. If they originate on the tibia or the fibula and they go all the way to the tarsals, they will be crossing just one joint. And even if they go to the metatarsals, they will be moving the foot at the ankle. We're starting with the superficial posterior compartment of the leg. We have two big muscles. We have what we call the gastrocnemius, which is your calf muscles. There are two bellies to it, so all of this is your gastrocnemius, and it does come down, and it continues as your calcaneal tendon right over here, which is your Achilles tendon as well. And underneath the gastrocnemius, you're going to find the soleus. So if we were to remove the gastrocnemius, which is right over here, all of this would be your soleus, which is also cut in this image. Now notice how the gastrocnemius crosses the knee joint, but the soleus does not. Right over here, that's where it originates. But both of them will cross the ankle joint. Therefore, both of them, once they pull up in this direction, they will bring your foot up and cause plantar flexion at the ankle. However, because the gastrocnemius crosses the knee joint, once it pulls it up, it will also flex the leg at the knee. There are two muscles that are located on the posterior compartment of the leg that are deep. These are going to be the popliteus and the plantaris. The popliteus is going to be this muscle. Notice you can see a little bit of it over here and a little bit over here. But notice how the fibers of this muscle are running in a different direction. They're running transverse like this, compared, for example, to the soleus where the fibers are running vertically. So this means that the popliteus will actually have a function to unlock when you have a fully extended knee. So if you stay standing up for a very long period of time, your knee tends to lock. And for you to be able to unlock the knee, your popliteus needs to contract. And because the fibers run in this direction, it will be able to twist your knee a little bit and unlock it. So that's the function of the popliteus. That's why it's called popliteus, because it pops your knee. The other muscle is what we call the plantaris, which is a very thin muscle. It starts over here and it continues. So this is your muscle and this is the tendon of the plantaris, and it goes all the way down to your plantar. That's why it's called plantaris. And because it does cross the knee joint, notice how it starts up here on the femur, it will do a little bit of a knee flexion, and And because it also crosses the ankle joint, it will do a little bit of a plantar flexion, but because this is a very thin muscle and there are huge muscles located in the same compartments and doing the same function, the main function of the plantaris is to serve as a proprioceptor. What does this mean? It means that it will detect the changes in the movement and the position of the body. So it will tell you where you are in space and time. And when we get to the nervous system, we will talk more about the proprioceptors. But the plantaris is one of the examples of a proprioceptor. So again, these are images with a little bit more detail. We can see the gastrocnemius, which is all of this. It continues as the calcaneal tendon. Underneath, we're going to have the soleus, which is this big muscle right over here. We can see the plantaris, which is this very thin muscle that has a very long tendon that goes all the way to the plantar. That's why it's called the plantaris. And over here with the fibers running in a different direction, this will be your popliteus. Again, we can see the popliteus a little bit more detail over here. And notice the fibers. Fiber orientation is very important because once the muscle pulls, you can see what direction that movement is going to go. So this will be the animation for plantar flexion, which I will play on the next slide. Notice how when the muscle highlights is when it's causing plantar flexion. So ballerina steps. In the lab model, we can see the gastrocnemius, which is the most superficial muscle. It continues as the calcaneal tendon. If we remove part of the gastrocnemius, we can see the soleus underneath, right over here. And here, this white line over here is part of the plantaris. There will be a better image of the plantaris when you watch the videos for the muscles in the lab. Next, we're going to focus in group 3, which are muscles that move the foot at the ankle. They will originate either on the tibia or the fibula, and they will insert either on the metatarsals or the tarsals. With regards to the lateral compartment of the leg, we have 2 muscles, and they will start with fibularis, which makes sense, right? Because on the lateral side, that's where we have the fibula. So we're going to have 2 muscles. The fibularis longus, which is this big muscle over here, and the fibularis brevis right over here. And once they pull, they will bring your foot sideways like this. So they will both cause eversion, or they will evert the foot at the ankle. Here again is just another image. This would be your fibularis longus. And you can see your fibularis brevis is just a little tiny muscle underneath over here. But both of them will evert the foot at the ankle. On the lab model, this will be your fibularis longus, and this tiny muscle over here will be your fibularis brevis. But notice how they are on the lateral side of the foot, therefore they will evert the foot. On the posterior side, we have muscles that will move the foot at the ankle and also the digits. This means that they will insert on the phalanges to be able to move the digits, and they will originate either on the tibia or the fibula. Let's start with the ones that are located posteriorly. We have 2 that you need to know, the flexor digitorum longus and the flexor hallucis longus. The flexor digitorum longus, like the name is telling you, it will flex the digits 2 through 5. Therefore, it will not flex the hallux because the hallux has its own muscle, which is the flexor hallucis longus. Now, because both of these muscles, they also cross the ankle joint, they will do plantar flexion of the foot because they are located in the posterior compartment. In addition to these 2 muscles, there's a third muscle over here, which is the tibialis posterior, which will also do plantar flexion at the ankle, in addition to inversion of the foot. So when they pull in this direction, they will plantar flex at the ankle, and notice how the tendons of the flexor digitorum longus and the flexor hallucis longus are going all the way to the phalanges, therefore they will also flex the toes and the hallux. Now let's look at these muscles in the next line because they are a little bit confusing with regards to how they are positioned in our body. So it would make sense that the flexor hallucis longus that's going to the big toe would be located more medial, but that's not the case. Notice how the flexor hallucis longus is actually located more lateral compared to the flexor digitorum longus. And what happens is that the tendons, they sort of cross underneath the foot, and the flexor digitorum will go to the digits 2 through 5, and the flexor hallucis will go to the big toe, to the hallux. So that's a little bit confusing, but just keep this in mind that the tendons do cross over and that the name is telling you exactly where the muscles are going to be going. Therefore, on the lab models, we can see exactly that. This will be your flexor hallucis longus that's located more laterally, and this one over here will be your flexor digitorum longus that's located more medially. So don't let that get you confused. In addition, here we can see the tibialis posterior located right over here, and this muscle, as we know, will also do plantar flexion and do inversion of the foot at the ankle. Here is a better image of the popliteus. We can see it over here with the fibers running transverse. And on the bottom of the foot, we have what we call the flexor digitorum brevis. So if we have a flexor digitorum longus, we're going to have a flexor digitorum brevis. This image is to show you exactly what I was talking about with regards to the tendons. Notice how they will cross over here underneath the calcaneus, which is this tarsal bone right over here. But this will be your flexor hallucis longus going to the big toe, and these will be part of the tendons of the flexor digitorum longus. Moving on, these are group 3 and group 4 in the anterior compartment, so muscles that move the foot at the ankle and the digits. They will originate on the tibia or fibula, and they will insert either on the metatarsals, the tarsals, or the phalanges. First, let's start with the tibialis anterior. It will originate on the tibia and it will insert on the metatarsals. Therefore, it will invert the foot. And we can see the tibialis anterior is going to be this big muscle anteriorly right over here that's going to be located on top of the anterior tibial margin. Then we have the ones that will extend the digits. We have a specific one for the big toe, for the hallux. That will be your extensor hallucis longus. And then we have ones for the digitorum, which will be the longus and the brevis. And they will extend the digits 2 through 5. So here is going to be your extensor digitorum longus going to your digits 2 through 5. And then we have a little bit of the extensor hallucis longus right over here that will go to your big toe. Now, all of them together, because they're located in the anterior compartment, once they pull it up, they will dorsiflex your foot. So they will bring your foot up in this direction. So they will all dorsiflex your foot at the ankle. These images highlight very well the extensor digitorum longus on this side. Notice how it's going to your digits. And the extensor hallucis longus, remember you can only see a little bit of it, but it does go to your big toe. And this big muscle over here is your tibialis anterior, which will do dorsiflexion at the ankle, together with the extensor digitorum and the extensor hallucis longus. So this is an animation for you to see how the dorsiflexion will occur, and I will show you on the next slide. Notice how when it's highlighted, that's when you're bringing your foot up, dorsiflexion. For the lab models, This would be your tibialis anterior, this huge muscle over here. And here we have removed the extensor digitorum and the extensor hallucis longus. So this would be your extensor digitorum longus. And this tiny one over here is your extensor hallucis longus. So this will go to your big toe, and this one will split into the digits. For the compartment of the leg, we can say that the ones that are going to be superficial in the posterior compartment, they will perform plantar flexion. The ones that are located in the deep posterior compartment, they will do toe flexion. In the lateral side, they will evert the foot. And on the anterior compartment, they will do dorsiflexion, toe extension, and in addition, notice how the tibialis anterior, which is located in the anterior compartment, has the tendon that goes to the medial side. Therefore, they will also do inversion of the foot.